Thank you very much, Kevin. And I would like to welcome as well Dr. Regina McQuillan to take a seat here, Austin McCracken as well to take a seat, and also Emer O'Flynn to take a seat, because this is a joint presentation between the four of us. So thank you. So we're absolutely delighted, and if any of you haven't picked one up as you came in, we're launching the All Ireland Research Priorities 2025 to 2030. There are 24 priorities, and these kind people are going to go through them with you. So why are we here? You know, we know that palliative care affects everyone. It is an ethical responsibility by the World Health Assembly. There is a growing need across the island of Ireland, both in the Republic of Ireland and in Northern Ireland, and a lot of you are very familiar with that growing demand. And in the Republic of Ireland last year, with the publication of the National Adult Palliative Care Policy, there will be a move to further integrated care, and that requires an evidence-based approach. In Northern Ireland, the Palliative Care and Partnership Programme and priorities also stress the critical importance of research evidence to design and improve care. So research is a pivotal area that is required to support the policymakers and the service providers in this area. And unfortunately, palliative care research is an underfunded research area, not only across the island of Ireland, but across the UK, across Europe and globally. It is an area that could really benefit other healthcare areas. We're delighted to have two key funders here today, the Health Research Board and the Public Health Agency, HSE R&D, who have supported the infrastructure support, as Karen mentioned, for the PCRN. But it is a real opportunity to invest in research in the palliative care area. So how were these research questions, as I mentioned, how did these come about? So the Institute was asked to become part of a UK-wide and include the Republic of Ireland James Lind Alliance Priority Setting Partnership Project. Sounds like a big mouthful, but the James Lind Alliance are an external facilitator that involve people with lived experience and professionals to help identify priorities. So they have a poll process. We have a report on this, so you can read that at your ease. It included a survey of patients, carers and health and social care professionals across the UK and including Northern Ireland, and then also including the Republic of Ireland. And then we had a final All-Ireland prioritisation workshop, and Regina, Emma and Austin were all involved in that. And there are other people here today who were involved either as participants or observers. So we're building on our previous work in this area, because some of you will say, well, we already have priorities, but they were developed back in 2015. A lot has happened since then. We've had COVID, we've had a change, and an evidence review was done to see, well, are some of these priorities still valuable? Are they still needed? And yes, a lot of them were, but there was considered that it needed to be a refresh and an update. So the project had a number of steps. There was a steering group that I was glad to be involved in with other key members across the UK and including in Republic of Ireland. There was also a lived experience group that very much impacted the project from the very start. There was a survey then sent out across the UK, including the Republic of Ireland, to healthcare professionals and people with lived experience of palliative care. From them, a long list of questions was created, and they were all systematic review and evidence checked to see if these answerable, have they been answered previously, and should they be brought forward. And then they were brought forward to a second survey that was again sent out across the UK, including the Republic of Ireland as well. And in the UK, they had to prioritise a setting workshop in November 2024, and they launched their priorities after that in February. And then we had ours not so long ago in October 2025. So for survey 1, there was 1,032 responses, 13.2% from the island of Ireland. This identified, as I said, 79 questions, and they were sent out in survey 2 for people to rank. And from that ranking then, 24 questions were brought forward for the UK one of the island of Ireland, and they were slightly different. They were mainly the same, but there was a few differences, and you'll see in the report. So who participated in the survey? I mentioned health and social care professionals, the public, volunteers, bereaved family members, carers, and people living with a serious life-limiting illness. And this is a lovely photo of everybody on the day. So we have all the people who were there. These were people who either observed, and we had somebody from the Health Research Board and the Public Health Agency, HSE R&D, and from the Department of Health were there, as well as the Institute members. And then we had 22 participants on the day, and they were an equal mix of health and social care professionals across disciplines, across the island of Ireland. And we also then had people with advanced cancer, heart failure, bereaved carer relatives, interested citizens, and they came up with the other 11. So we had 22 in total. And as you can see, there was a lot of group work and discussions facilitated by 3 James Lind Alliance facilitators to come out with the ranking of the top 24 priorities. So, and here we have when the final discussion and final group saying which the different priorities were. And just to say, we got feedback from the James Lind Alliance to say that there was very good discussions in the small group, and there was great consensus and agreement in everybody listening to each other and coming together to identify those priorities. So with that, I'm just going to hand over now to Regina McQuillan, who will take you through the top 10. Thank you, Regina.